When I get back to my home, the first day was okay. Suddenly, when I was home, it started the phantom pain. It was a very bad experience. The pain was so bad. I feel swelling. I feel numbness too. When it's getting cold, my leg that one I don't have it got coldness. That kind of cold, you couldn't handle it.
So what ended up happening for Raul was that he was kind of failing in all different conventional blocks, like things we would do for putting in injections every 3 months with steroid and local anesthetic, and he also failed a lot of the medical management. So at that point, really, that comes to the idea of using stimulation therapy. So when patients try to figure out which stimulation therapy to use, the question comes, should we put the actual leads in the spinal cord or should we put it in the dorsal root? The dorsal root ganglion is an offshoot of your spinal cord that correlates to a very specific nerve that's coming from your spinal cord to a specific extremity or a portion of your back. For dorsal root ganglion stimulation, the basic idea is if I see a patient that has, let's say, leg pain, there are certain roots in the spinal cord that send electrical signals to the leg, and the leg sends back electrical signals to the brain saying that it's in pain. The therapy basically consists of two components. One is the battery and one is the lead. So the lead actually gets put in the dorsal root, and the battery sends energy to the lead so that the current can be put into the root itself, and that it can be controlled wirelessly with an external iPad that modulates this current to make sure that there's adequate amount of pain control.
I feel that it really works for me. No more phantom pain, no more sciatic nerve pain, no more using the pills for those 7 days. So I'm hoping that soon I have the permanent DRG implanted on me.
So he actually came back with almost 90% reported pain relief, which is very difficult to do. 90% is outstanding. But I think more important than just him saying he had better pain improvement is the functional improvement he got in that trial period, which is really important for us to consider implantation. So getting around in his house, doing dishes, being able to have a more meaningful relationship with his spouse. It ripples through all of your social interactions, your personal life. But I think what patients need to understand is I think we're at a point where the science is growing fast enough and technology is merging with that science to provide really good solutions. There is hope. We can't really say we can cure pain. There's never really truly a cure, but neuromodulation comes pretty close to this idea of solid pain control over a long period of time that has worked and shown considerable evidence, I think.